No two kids tell the story of how long-lasting the effects of C-section deliveries can be than two beautiful fraternal twins named Jordan and Teo. So for Jordan's birth, everything went according to plan. At 36 and a half weeks, Jordan was head down, first in line, born vaginally. But for Teo, things were different. Just before it was his turn, Teo flipped back up into breech position. After they tried multiple maneuvers to get him back to head down, he had to be delivered via a relatively quick and emergent C-section. And from that point forward, everything you learn about the science and reality of long-term C-section complications in kids became crystal clear after tracking the first 12 months of these two boys' health. So Jordan ate better, was calmer, was quick to relax. He slept better and was generally just a very easy baby. Teo, on the other hand, had all sorts of difficulties with digestion, sleeping, soothing, and developing on track. Teo was always smaller, he was tenser, more stressed out, and he just struggled to gain weight as easily. He also had multiple inflammatory skin reactions, ear infections, and other struggles early and just often. At around 6 months old, Teo began suffering from infantile spasms, and these are some of the worst things that a parent can ever watch their kids go through. After about 24 hours in the hospital, multiple drugs and injections, Teo still did not respond. He continued crying uncontrollably. He had spasms until he received a neurologically-focused chiropractic adjustment to release his built-up tension and calm his entire central nervous system. The instant changes in Teo after that adjustment were absolutely remarkable. His entire body relaxed, he stopped crying, and he came out of those spasms. So Teo continued to get daily adjustments for the next 2 weeks, and he stayed at a 3 times per week intensive adjusting frequency for the next many months. But in time, he healed entirely from his cesarean complications and neurological injury. So Teo and Jordan, they have the same genetics, the same diet, the same environment in every single way. So essentially, every other variable was controlled for these two, meaning the only major difference was that Teo was born by a C-section and Jordan wasn't. The physical trauma and the neurological tension that C-section deliveries can cause is exactly what Teo was left with. That traumatic start to life left his entire central nervous system stuck in a perpetual state of what's known as subluxation and dysautonomia, both of which are linked to C-section deliveries in research. We'll explain all that in detail later. But first, most traditional doctors aren't going to talk to you about these complications. They're often going to solely blame genetics for a child's struggles. And natural holistic health websites or practitioners, they're going to blame toxins, dairy, gluten, or vitamin or mineral deficiencies. But with both of those being truly 100% identical in Jordan and Teo's story, it's clear to see that the physical trauma from C-section deliveries can absolutely have negative consequences on a child's life months to even years later. So there is certainly a noticeable difference in babies born by a C-section versus vaginal delivery. In terms of the most common medical complications, things like breathing difficulties, low APGAR scores, inability to latch and gain weight, and digestive distress, they're often seen in infants born with C-section, but what we want to focus on in this video isn't just those short-term medically documented effects of C-section deliveries, but also the long-term effects. So the first challenge that is almost an absolute, almost always overlooked and missed with C-section deliveries is the onset of subluxation in the infant's cranial or skull region up here and their upper cervical or neck region. These are the most easily injured and altered areas for infants born via a C-section, simply because at such a young age, they cannot protect those precious muscles, nerves, and joints that are protecting their brainstem and spinal cord from injury. Add a pair of hands and attach a vacuum to their fragile heads and then pull, and research shows that nearly 99% of the time, there is going to be damage done to the neck. This was exactly the case for our son Brooks, who was born by emergency C-section. Not only was his head stuck back in extension, but he would also only look to the right. So his lack of jaw and neck movement not only led to the creation of blisters on me while nursing, but that little guy wanted to nurse every 30 minutes, day and night, because he couldn't effectively draw enough milk down during a feed to fill him up. So if you're not familiar with the process of a C-section, the amount of force placed on a child's skull, neck, and brainstem during that delivery process is immense. It is far more physical than would ever be allowed after the birth process. So while it may be life-saving in the moment, it is so important to recognize that that procedure is also life-altering from there on and needs to be followed and addressed. We all know to protect the neck, hold the head for brand new babies and infants, but we've made it completely normal and okay to use the head and neck as physical leverage to twist, pull, and torque during the C-section birth process. And it's not just upper cervical and brainstem trauma that can come from C-section deliveries. There's actually an entire list of other long-term complications that each parent deserves to know about. So here's a short list, okay? Digestive distress, things like colic, constipation, eczema, reflux that come from missing out on optimal activation of the thoracic spine that would normally occur during a vaginal birth. So the nerves within that thoracic region, they control gut motility, absorption, assimilation of nutrients. So when that activation around the thoracic cage doesn't occur, these processes can be affected. Next is respiratory and chronic immune struggles. This can come not only from the lack of movement throughout the ears, the nose, the throat, the lymphatic system, from just jammed up neurology in the neck, especially the vagus nerve, but also from the disruption of the gut flora. So it's standard in C-section deliveries to administer antibiotics prophylactically to the mother before the incision is made to decrease her risk of infection. This sounds like a good thing, but these antibiotics then pass through the placenta to the baby, which wipes out all of their bacteria, the good and the bad. So think about this. When a vaginal birth occurs, it's called a seeding process that happens as the baby passes through the birth canal, and all of those good bacteria enter the baby's eyes, their ears, their nose, their mouth, and essentially they're the first building blocks for their development of their brand new microbiome in their immune system. So the problem is twofold here. The antibiotics given to mom wiped out the little bit of a microbiome that the baby may have had, while they never got to receive the seeding and colonization of a super diverse microbiome from mom. So what can you do? When parents start looking for help healing their kids naturally and without drugs, we always encourage them to start in the same place. It's always the nervous system. The nervous system is the main air traffic control system that modulates and controls each and every other vital system in the body. From the gut and the digestive system to the immune system, motor system, hormones, emotions, literally everything is controlled by the nervous system. Especially when you feel like you've tried absolutely everything already, chiropractic is often the missing link. Nothing works well if the nervous system isn't working well, first and foremost. Any motor tone challenges that your PT, OT, or speech therapist may be working with your child on can be improved when the tone of the nervous system and the spinal nerves are addressed first. Any gut and digestive issues, such as food intolerances or allergies that your child is looking to avoid, they are all first controlled by the vagus nerve and the autonomic nervous system. Any immune challenges and chronic illness like seasonal allergies, asthma, ear infections, or croup, they are all governed and modulated first by the vagus nerve and autonomic nervous system. Do you need me to say it again? It's always the nervous system. No matter what you've tried to help your child to heal and improve, it will be enhanced when you add neurologically focused pediatric chiropractic care. If you have any questions, parents, please leave them in the comments or send us a DM. And lastly, please share this video with any struggling C-section mamas out there. That's currently 33% of all of you moms, which is sad, but we're here to help. We've got you.